Today is September 22nd, 2011. This is Arly Johnson. Hi, Arly.
Hello, how are you?
Good. Arly was kind enough to come in today to just share her story. Arly came in May, and when she initially came in, she had severe pain in her liver region. During the history and consultation, she was holding that area on her right side of her rib cage. She had severe digestive problems, diarrhea, and a variety of complaints, as well as joint pain, and she's an adult type 2 diabetic, and her blood sugars were out of control. Is that true, Arly?
Yes, it was.
And Arly, do you want to just share kind of your story since May? I'm so proud of Arly in the fact that she just told me before we started videoing here that she's lost now 27 pounds and multiple improvements, and she'd just like to share them. Go ahead.
Well, I'm 68 years old, and when I came in before, I had seen 7 different doctors telling me that most of them told me that it was just in my head, that I had this doubling over pain, that when I was at work one time they insisted that I go to the emergency room because it was so bad. And I got there and all they did was give me morphine and sent me home. So I decided to come here to see if I could improve my health through diet and through herbal supplements. And I'll tell you, it's worked. Like he said, I've lost 27 pounds. My AC1 went from 7.9 to 6.7.
And your schedule will be retested in October.
In October.
Yep.
And my glucose went from like 265 to today it was 102. I have so much more energy.
Could you just tell the story you shared with me with work that, you know, we just talked about how intense it's been this past week? And
oh, this week at work has just been non-stop all day long. You know, we get 15-minute breaks, but you can't recover in 15 minutes breaks. But if I had worked this week in May, I'd never made it. I could not have physically done it, mentally done it.
you mentioned you thought you probably would have had to take the whole week off. Is that?
Oh yeah, to recover, yeah, because well, the pain would have been too much for me to handle. I mean, it was getting up to be, like they say, 1 to 10. It was getting 7 and 9. The pain was excruciating.
Has the program been hard, Arly? When you came in, you know, we looked over your labs, and I'm going to just show those real quick. Arly's A1C, according to her lab testing, as you can see, her hemoglobin A1C was at 7.9, and her fasting blood sugar on the morning of May 13th was 149. She mentioned this morning her blood sugar glucose level was 102, and that her A1C at her last check, which was about 6 weeks ago, was a 6.7. But overall, how difficult has it been to make the changes that, you know, I asked you to make with your diet and your lifestyle, and just taking your supplements and taking your, you know, doing what we've asked you to do? How 0 to 10, 10 is excruciatingly difficult and painful with the diet, lifestyle. 0 being no difficulty at all, seamless. How hard has the program been?
Well, now it's getting to be a 1 and almost a 0, because now I've learned what I can and cannot have. And I feel so much better that it's not worth doing
what you did?
Eating the bad things. It's just not worth it. I've tried experimenting a little bit to see how I feel if I eat something, and I don't want to do it.
Good for you.
It hurts too much, and I just feel so much better. I have, like I say, I feel like I'm 45, and a lot of the people at work are dragging around, and I'm the oldest cashier at work, and people can't believe it because I have so much more energy.
Good for you. Proud of you. I'm proud of the hard work that you put in.
And I've been exercising, which makes me feel so much better. And if I don't do it, I know I didn't do it. So
You can
the
tell.
next day I do it. I get up a lot earlier before I go to work, and I do my 30 minutes of exercising.
Good for you.
So I feel really good.
Good for you. Let me ask you one last question. Do you have any advice for future patients who are diabetic and looking for alternatives other than insulin shots and medications and everything else that goes with that? Do you have any recommendations for people in the future, Arly?
Yeah, just do it. I mean, to put chemicals into your body and all the, I mean, you can see on the news that they have so many warnings. There's no warnings about food unless you're allergic to them, but you learn to do that, and you feel 100% better. Just do it.
Good for you. Arly, do I have your permission to share this with future doctors, patients, or students?
Yes, you do.
Are there any restrictions on that?
No,
Thank you so much.
thank you.